In addition to establishing the Health Emergency Operations Center located in the Ministry of Health, the government of Barbados also established an augmented National Security Council. There is, of course, a Security Council for Barbados that is made up of key elements of the security of Barbados. It was augmented because they added on the addition of the Department of Emergency Management and a number of other technical and key officials related to the management of COVID-19. And in addition to all of that, the government of Barbados set up a special subcommittee of the cabinet to manage the COVID-19 response. And that subcommittee would have been made up of a number of key ministers, of course chaired by the Prime Minister, but including ministers responsible for Labour, Minister of Health, of course, Minister responsible for Foreign Affairs, a number of the critical ministries. Perhaps I should pause and recognize the presence of the parliamentary representative. Welcome, and welcoming you to your own meeting. We already had a lot of the machinery in place to manage the COVID-19 response. It had already developed, and in fact by early February, before we had our first case in March, Barbados already had passed through the cabinet and had gotten approval for the National Preparedness Pandemic Plan for COVID-19. That was the 4 million plan, the National Preparedness Plan, Pandemic Plan. Now, the planning for COVID-19, and one of the reasons behind Barbados' successful management of the disease today has been because not just the extensive planning that I'm speaking about, but also looking ahead, using the science that has been available to us to guide and manage our response. We therefore sought to ensure that we had the best tests that would have been available for COVID-19. Barbados always used what is called the PCR test, which is the gold standard in testing for COVID-19 recognized by the World Health Organization. Barbados, in addition to that, took the very early policy decisions around protecting its core health infrastructure. Very early on, Barbados made a determination that there would be no visits to elderly care facilities because we had seen what happens if the disease gets into one of those facilities. There were early on in the pandemic cases in Italy and Spain where persons were found dead and abandoned in some of those elderly care facilities. And those are first world countries with huge amounts of resources, health resources. We also made the determination that we would protect the key health institution, the Queen Elizabeth Hospital, and therefore visits were prohibited to the Queen Elizabeth Hospital, and dedicated facilities for the quarantining and treatment of COVID-19 were established. So we had in the very early days at Paragon the establishment of a quarantine facility and a treatment facility, and we stood up the health care facility at Emmore as an isolation center which had been put in place for Ebola. That was stood up and made available to treat persons who might have fallen ill, protecting and insulating the Queen Elizabeth Hospital. One of the most challenging points of the COVID-19 response. I just took a look, courtesy of one of the international websites that monitor COVID-19. There are over 16,400,000 cases, reported confirmed cases as of now. And in fact, the epidemic is gaining speed, not losing speed. So COVID is around, it is growing, it is accelerating. In Barbados, we currently have about 6 or so live cases of COVID-19, all of them in isolation at the Harrison Point facility. What the government of Barbados has done in terms of initiating commercial air traffic once more, is to set in place a number of specific protocols to manage and monitor those persons coming into Barbados. So, everybody coming into Barbados has to do one or two things. Either you have a negative COVID-19 test within the past 72 hours, which you then upload on the website before you travel to Barbados, or if you land in Barbados without the test, you have to be tested at the airport. Anyone who refuses to be tested, if they're a visitor, will be refused entry to Barbados. No exceptions. You come in, you don't want to be tested, thank you very much, go back out. So we are facing still the serious challenge of having to live with and manage COVID-19. The virus is not making any exceptions, therefore neither should we, in terms of the observation and the adherence to the protocols that have been set in place. We are confident, however, that we have managed to bring a response to COVID-19 in Barbados that has won the, not that we've been seeking it, but has won the congratulation, admiration, support of the World Health Organization, the Caribbean Public Health Agency, the public health agencies across the Latin America and the Caribbean. Many of them actually wish they could be in a position where we are, basically with zero local spread of the virus and manageable numbers of imported cases. Or who are you protecting if you are all alone? And similarly, outdoors. If you are outdoors, and that is why the advice is, if you have to be indoors, to be in a ventilated space, keep the windows open and so on. Because if you're outdoors and nobody is within, I see people exercising by the gym, where you go and exercise sometimes, running or walking with a mask on and nobody near them. They're putting themselves at risk of hypoxia or other things because of inhaling some of the carbon monoxide or not getting enough oxygen. So there's no standard answer. It depends on the individual. However, if wearing a mask is required, you can be challenged because it is that supermarket that can be closed down if it allows people inside without appropriately wearing the mask. And wearing the mask and not covering your nose leaves you and other persons at risk because the virus is spread through respiratory droplets. And if your mouth is closed, you're still breathing through your nostrils, and that is where respiratory droplets can escape.